Everyone, welcome to researchmd.com. Another great presentation. We have given presentations on antibiotic. We talk about cephalosporin in detail. Today, in a summary, we're going to show how to remember with some mnemonic also. Sometimes this mnemonic helps us to remember much better. Let me introduce myself, Dr. PRAMIL, Program Director, Internal Medicine Residency, Transitional Residency, Associate Professor of Medicine, Two Large Medical School. So, in today's lecture, we're going to look at cephalosporin with some mnemonics so we can remember it better and talk about some of the important characteristics. Okay, so let's start our lecture today. We're going to start with the first generation cephalosporin. Okay, the mnemonic we need to look at is FAPHA. Remember that. Okay, when you talk about cefazolin, cefadroxil, cephalexin, cephalothin, cefalpirin, and cephradine. Okay, so those are the things in the first generation cephalosporin. When you talk about the first generation of cephalosporin, look at the gram-positive coverage. They got pretty good gram-positive coverage, but look at the gram-negative. It's very low. Okay, so if you could use some of them for the gram-positive coverage is good. Now let's look at our second generation. Unfortunately, we don't have much mnemonic to describe this. You got cefoxidin, cefotetan, cefmetosol, and cefprozil. Okay, then a couple of other drugs you have to remember is cefaclor, cefuroxime. Even though it's FA, it doesn't belong to the first generation. Okay, and even though it's IME, it doesn't belong to third generation. These are the couple of exceptions in the mnemonic, unfortunately. Now, cefoxidin and cefotetan have anaerobic coverage. Remember that. That's two things we just have to remember. Now let's look at the third generation cephalosporin. What is the mnemonic up here? 110 IME. 110 IME. IME. Okay, that's the mnemonic we have to remember. So let's start with the first one. Ceftriaxone, ceftibuten, ceftotaxime, ceftazidime, cefodaxime, cefaxime. Okay, IME. So remember 1, 10 IME. That's our mnemonic to remember that. Okay. Cefdinivir, Beta-lactam is the other, which we don't have any mnemonic for that, but we just kind of put it out there. Now look at the coverage up here. Very less gram-positive coverage, but when we come up here, the gram-negative coverage is kind of increasing. When you look at the first, second, third, fourth, and fifth, look at the gram-negative coverage is increasing. Remember, the thing we need to know, ceftazidime has a good Pseudomonas coverage. Okay, that is the only third generation cephalosporin with some Pseudomonas coverage. We need to know that. Okay, now let's look at the fourth generation. We have to look at the mnemonic is PI, PI, cefapime or cefipim, cefpirone. Okay, and then remember, we got gram-positive and gram-negative. Good gram-negative. What does it cover? Pseudomonas. Remember that. Pseudomonas it cover. Okay? Now, when you look at the fifth generation, these are the newest antibiotic. We have two names here. ROL. Ceftaroline, ceftobiprole. Okay? Now, ceftaroline is very good drug for MRSA coverage, okay, and ceftobiprole can also cover Pseudomonas also. Remember that MRSA coverage. So it's a good drug like gram-positive and gram-negative coverage. They're like the fifth generation cephalosporins, okay, and then remember fourth generation cefepime. You can use it for MRSA also, but the main thing we use it as the Pseudomonas infection. So let's look at it and summarize one more time. We got first, second, third, fourth, and fifth generation over here. And then look at the first generation, our mnemonic is cefazolin FAPHA. Remember the FAPHA. And look at the coverage. Gram positive more, gram negative less. okay? And then when you come to second generation, cefoxidin, cefotetan, cefmetosol, cefprozil, we don't have a mnemonic, just remember it kind of belonged to the second generation. Only a couple of exceptions. Cefaclor, they use Fa up here, cefuroxime, even though it belonged to that mnemonic, don't get confused, okay? Now, the thing on the third generation, remember, ceftazidime has Pseudomonas coverage, so you may want to use it in a clinical situation. It can also cover the Borrelia. Okay, when you talk about second generation, cefoxidin and cefotetan have what? Anaerobic coverage. Okay, when you talk about the fifth generation, you got anaerobic coverage also here. Okay, Borrelia coverage in the third generation. So remember all of this. So if you want MRSA, pretty much you can use this fifth generation. And if you want Pseudomonas coverage, you can use the fourth generation. Well, let's look at which one have like Pseudomonas coverage. You got Ceftobiprole have Pseudomonas coverage. You got fourth generation have Pseudomonas coverage. You got ceftazidime also Pseudomonas coverage. Okay, MRSA coverage, mainly we focus on the ceftaroline. That's what we use in the United States. But cefepime also have good MRSA coverage. All right. Thank you so much for watching. We'll be back with another presentation soon. God bless.